The terms dryness and dehydration are often used interchangeably when we're talking about the skin, but it is important to understand that there is a difference between the two. Dryness is caused when there is a lack of oil in the skin, whereas dehydration is related to when there's a lack of water in the skin. There is also a misconception that oilier skin types are not necessarily dehydrated, when in fact you can have a skin that is excessively oily but is also dehydrated at the same time. An oily skin is oily because of excess oil production, whereas it can be dehydrated because of a lack of water in the skin. Under normal physiological conditions, the skin should be quite plump, and that is because there would be an adequate level of hydration in the skin, and water is really essential in making the skin feel plump and supple. And then as a consequence, of course, with a reduced water or reduced hydration in the skin can start to look less plump, it can look less supple, it can look dehydrated, dull, and a little bit flaky, and fine lines can also be more prominent. Dehydrated skin can also look quite rough, it can look less elastic, and in general just look very devitalized and not look like healthy glowing skin. You might find in clinic that patients are not necessarily coming to you for a concern of dry or dehydrated skin. Patients might say that they have a concern with the dullness of their skin or the roughness, or that they feel like their fine lines are more prominent, where the underlying cause of that is really that lack of hydration in the skin. Dehydrated skin will be less resilient than hydrated skin because it can't hold on to that water, and therefore barrier function can be compromised. Remember that dry skin is caused by a lack of oil production, and people with a drier skin type might be dry due to genetic factors, but there are also a number of environmental factors that can also affect oil production in the skin. Skin dryness will often manifest as red, flaky skin, irritated skin, and can be the hallmark of some clinical indications like psoriasis and eczema. Dryness in the skin can also be caused by extrinsic factors such as various medications, the environment, the natural aging process, and not using a good topical skincare, but also things like using hot water too much or in excess. You might hear dermatologists regularly say that using a lot of hot water on your skin can strip those ceramides and oils off your skin and make you actually feel dry. There are also a number of hormonal factors that can affect sebum production and therefore how oily or how dry your skin is. Also, stress and the fact that increased cortisol circulating around your body also affects skin dryness is something that a lot of people don't think about. And we know that having a stressful life and having an increased cortisol in your body is going to reduce ceramide production in your skin and lead to more dryness. Another factor that you might not think about contributing to dry and dehydrated skin is the climate. During winter, we have less blood flow to the skin, and that's going to mean that there's less oxygen and nutrients to the skin and less water. So our skin will generally feel drier due to that dehydration, but we'll also feel drier because we're getting less ceramide and sebum production and we have less oil in the skin. Another factor relating to weather that can affect your skin is how humid the air is. So humidity is really a measure of the amount of moisture or water that's in the air. Sometimes in a more humid climate, some people might feel like their skin is quite revitalized and hydrated and feeling really great because they're getting extra moisture from the environment, whereas some people might feel that that's too excessive and they might not like that feeling on their skin. In terms of dryness and dehydration, there are other things that we need to think about, such as which medications we're taking and how they might actually affect our skin and the production of oil and the loss of water. And we also need to think about what we're doing to our skin topically. Are we cleansing properly? Are we moisturizing? Are we over exfoliating, causing dryness and irritation? There are many products out there for sale on the market that are very astringent, have very high alcohol content, and can be very harsh and damaging to your skin and your skin barrier, leading to an increase in dryness and irritation. And this is why it's really important to use really good quality skincare that is suited to your particular skin type and skin concerns. For example, if you have an oilier skin type, you really shouldn't be using topical skincare that is heavy in lipids and cholesterol and ceramides, because that's just going to add to the oiliness of your skin. Whereas if you are somebody that has a drier skin type, you will want to include those ingredients into your skin, as well as maintaining good hydration by using ingredients such as hyaluronic acid. Given that we live in Australia and we have very harsh sun because of a big hole in our ozone layer, it's really important to protect our skin against the activity of those really harsh UVA and UVB rays. If we think about hydration in the skin, in particular in the dermis, we know that UVA damage actually can cause degradation of collagen and can actually cause more dryness in the skin. And over time, this can lead to your skin not looking supple and healthy and not being able to repair itself when it's exposed to other environmental stresses or more UV damage. Sometimes when patients have dry, flaky skin, their first thought will be to exfoliate, whereas that might actually be making the problem worse. And that dryness can be combated by using a really nice thick moisturizer full of those fatty acids, ceramides, and lipids to help improve and maintain the integrity of that skin barrier. Hopefully now you can see that although dry and dehydrated skin can actually look quite similar on the surface, that they're caused by two very different physiological issues, being a reduction in water versus a reduction in oil. And therefore understanding what the cause of that dryness or dehydration is going to enable you to be able to prescribe the correct topical skincare to combat those issues in your patients. So have a think when you see your patients next. Do you need to feed into the water content of the skin, or is it an issue with there not being enough oil production in the skin? And don't forget that in some cases, it could in fact be a combination of both dryness and dehydration, and that it's about balancing those two for the optimal results in your patients.